Okay. I know this is not an easy time for any of us. Watch, it's been about 2 or 3 months since we are quarantined. I've even lost track of time. Literally, it feels like the same day is repeating itself again and again. But it's very important to stay healthy during this lockdown. Because as they say, health is wealth. And if you're not healthy, how will you be happy? So, you must be seeing all these news circulating on social media platforms on how to defend yourself from the coronavirus. But I decided to do something different. I decided to gain a more professional insight about how to stay healthy and happy during this day. I'll be interviewing Dr. Santanu Sen, a renowned pediatric consultant at Kokila Ben Dhirubhai Ambani Hospital, who will help us gain a better insight on how to stay healthy physically during this lockdown. So let's get on with this interview. So, hi doctor. My name is Asmita Valiani and welcome to Expert Advice. I'm so sorry for taking your time. I just had like a few questions to ask you. So, basically,
Okay.
uh, what advice would you like to give the kids during this time of lockdown, like for their health?
All right. So you got to define kids further. So you got to tell me what age group you're looking at.
So, all
So pediatrics, if we deal with, it's kind of like 0 to 21. So
yeah,
which
so
age
like
group are you?
basically a generalized view of health on all the kids.
Okay. So generalized view of health would be a couple of things. One is, of course, I mean, which is the basic thing, isolation is very important, which means that, yeah, everybody needs to stay at home and they really need to stay at home and not to go out unless it's absolutely imperative, which means that there's a problem with getting enough physical exercise. So
Yeah.
that kind of ties into the next important point that there has to be some way that everybody needs to take out at least about 20 minutes to half an hour to get some physical activity, which people can do, kids can do at home, young people can do at home, whether it's kind of like even simple taking a skipping rope and jumping or following a YouTube exercise class for half an hour, whatever it is would be fine. Young kids, again, just plain simple running around should be fine. Something to keep active. That's really important.
Okay. And I've also heard that since like everybody during this lockdown, we are not getting enough vitamin D, and because of
Mm-hmm.
which a lot of people are having vitamin D deficiency, and they are more prone to this virus because of
Right, right.
the. So
I don't think they're more prone to the virus, but you're certainly right that because everybody's staying at home, so vitamin D is only made when you are exposed to the sun and nobody's getting enough sun exposure. So it would be good to take a couple of vitamin supplements. In fact, not just vitamin D, but usually what I suggest is to take two, well, a couple of supplements. One, certainly take vitamin D because you're not going to get enough of. Take vitamin C as well because that's some evidence out there to say that if you take a adequate amount of vitamin C, it kind of improves your immunity. It makes you more likely that you fight the virus more effectively and get better quickly. And finally, any multivitamin combination is a good thing because, I mean, we're all eating home, we're eating at home, we're eating healthy food, which is great. But because we are not getting enough exercises, we are not really getting much. So it's pretty good to take a multivitamin supplement.
okay, and if one wants to pursue this field which you are in, pediatric oncology, how should one go about it?
Ah, that's a good question. So, I mean, it's not an easy field to get in. I mean, first of all, of course, you have to be a doctor. And to be honest, it's kind of a field which you have to have a calling for. So it's not an easy field to get in because you can understand we deal with kids with cancer, which can be stressful, which can be heartaches, which can be quite upsetting to everybody. What happens is that if you're a doctor, you've done your MBBS and you have decided to specialize in pediatrics, and as you're doing pediatrics, if you are exposed to the specialty and you like it, that's when you get into it. Sounds very difficult, but it also has got its rewards. And to be honest, I would not like to do anything else. The reason I said it's got its rewards is because it's a specialty whereby we can actually cure more than, I would say, 70% of all our deaths. So, whereas in adulthood, that's not quite there. So, it's an easier disease. It's not an easier disease. It's a disease that has got a better outcome compared to the adult population.
Okay. So thank you, doctor, for giving your time. Hope kids
No
use
worries.
this advice and stay home and stay safe and healthy.
Thank you.
So thank you for
Thank
giving
you
your
so
time.
much. Thank you. Bye.
So I would like to thank you all for staying with me throughout this entire interview. I hope you all gained enough information on how to stay healthy during this lockdown. And lastly, I would like to mention, stay home, stay safe, and flatten the curve. Thank you.